I'm Derweesh. I'm a urologic oncologist. I'm a professor of urology and radiology at the University of California, San Diego School of Medicine, and I'm the program director of the Urologic Oncology Fellowship. I've just recovered from surgery for stage 1 kidney cancer, or treatment for stage 1 kidney cancer. How often do you need to see me? And what does that follow-up consist of in terms of scans or labs or other types of surveillance? Generally, urologists recommend what we call establishing a postoperative or a post-treatment baseline at the 3 to 6 month mark after treatment by obtaining surveillance labs and scans. Surveillance labs include kidney function tests, a complete metabolic panel, as well as a blood count, a complete blood count, the CBC, in addition to a urinalysis. Imaging will consist of imaging of the abdomen or abdomen and pelvis via most frequently a CAT scan, less frequently an MRI, as well as imaging of the chest being the most common location that kidney cancer metastasizes to. Once the postoperative baseline or the post-treatment baseline has been established, surveillance then proceeds along a yearly basis with imaging and with labs for most patients with stage 1 disease. Obviously, that may shift based on the type of tumor. There are some stage 1 tumors that may be of a higher risk for recurrence, and that the management may be individualized further by the treating urologist or the consulting medical oncologist based on what is seen in the pathology report. Beyond that, the most recurrences can oftentimes occur during the 70 to 80% occur in the first 2 to 3 years after surgery, or treatment. So more frequent follow-up gets done during this time, and follow-up after that can continue certainly on a yearly basis until about the 5-year mark. Beyond the 5-year mark, if imaging-related follow-up or lab-related follow-up is individualized with the patient. There are reports in the literature of late recurrences from kidney cancer, even stage 1 kidney cancer, and late recurrences being greater than 10 years out. So there isn't a specific recommendation to cease follow-up at some point. However, follow-up gets individualized in terms of longer-term follow-up based on a variety of different factors, including patient life expectancy from other ongoing disease processes, as well as the actual tumor subtype and tumor stage and grade, et cetera. So again, there are guidelines that are put out by groups like the AUA or the NCCN that make recommendations, and it's within this framework that generally urologists or medical oncologists who are following patients with stage 1 kidney cancer will be basing their regimens, but again, individualizing these based on specific patient circumstances.